What are the things that we look at when an implant is failing? The patient's complaining of some discomfort associated with the implant. We take an x-ray of the site. We can either see reduced bone or there's a soft tissue problem with the gum around the implant. Sometimes we can take care of those without removing the implant by cleaning the area out and applying different kinds of, whether it's bone or medicaments around the implant. Sometimes the implant does have to be removed, and when that happens, then we're going to go through our grafting procedure and redevelop the site to place the implant properly. And the patient that I saw earlier this week, it was on the upper right side. She had 2 implants placed. The dentist did not do a sinus elevation, compromised in the length of the implant that he placed, and then he didn't really treat the soft tissue correctly, so she had a combination problem. And then her solution is going to be removal of that implant, which doesn't have much bone left around it, and I'll correct that, develop the site. 4 months after I do that, I'll be able to put the implant in correctly, and it'll resolve it for her. I have protocols for following all kinds of procedures, and the patient gets the protocol sheet. Do these things, you will have a successful outcome. Do we have an accurate medical history? Are there any problems that they have that will prevent integration of an implant? And if we place the implant, are we following the procedures to direct the forces properly on the implant without any side forces or shearing forces on the implant? So we try to address all of that to have the kind of outcomes that we do. And we have a very high percentage of success rate, over 98%.